Migraine: symptoms, causes, types, diagnosis, treatment, and home remedies. Migraine is a type of headache that causes inflammation throughout the head. It affects men and women alike. Symptoms of migraine: headaches are common with migraine. However, they can be more severe than regular migraines. If you have migraines, it may feel like your brain is shrinking at times. This can cause confusion and make it difficult to concentrate on tasks. As a result, you may find yourself unable to enjoy everyday activities. Your symptoms tend to get worse when you fall asleep, have trouble getting restful sleep, or suffer from insomnia. You may also experience sensitivity to light and sound. If this happens, you might find yourself having difficulty moving your body. At the same time, you may experience stiffness or pain in your neck, shoulders, and jaw or face area. You may even find yourself experiencing nausea. In extreme cases, you may develop paralysis. Causes of migraine: certain factors increase your risk for developing migraines. They include genetics, hormonal changes, environmental triggers, stress, and medical conditions such as diabetes, high blood pressure, and autoimmune disorders. Genetics is one factor that plays an important role in developing migraines. For example, if you possess certain genes that predispose you to developing migraines, then there is a chance that you will develop them too. Similarly, stressful situations or life events can lead to migraine onset. People with pre-existing migraine headaches are also at increased risk for new ones. On the other hand, people who do not suffer from migraines are at high risk for developing them later in life. Symptoms of possible medical conditions that may cause migraine. Certain medical conditions can trigger migraines. These include hormones like estrogen or testosterone can affect how the brain processes pain. Some medical conditions can trigger migraines by interfering with the production of these hormones in the brain. These conditions include polycystic ovarian syndrome, pregnancy, and postpartum depression. Certain medications can cause migraines as well. Examples include aspirin, nonsteroidal anti-inflammatory drugs, NSAIDs, antidepressants, and stimulants such as cocaine. An immune system disorder can trigger migraines as well. For example, a virus infection can trigger migraines. Additionally, some diseases like HIV/AIDS or Lyme disease can cause migraines. Certain mental health conditions, such as anxiety or depression, can also trigger migraines. Additionally, if someone has been diagnosed with chronic migraine, then they may be at higher risk for developing migraines. Types of migraine. There are several different types of migraine. The most common forms include cluster headache, cluster sensation, multiple sclerosis, and postural migraines. Cluster headache. Cluster headache is caused by two main things: inflammation and pain relief. When you have an attack of cluster headache, you typically experience throbbing pain that feels warm to the touch and pulsating in your temples. Your vision tends to become blurry, and you may have sensitivity to bright lights. However, you might also experience nausea. Cluster sensation. Cluster sensation causes discomfort in your eyes, which creates a feeling that the world around you is moving. Your vision becomes blurred, and you may have sensitivity to bright lights. You might also experience tinnitus, which is the ringing or buzzing sensation that occurs when something is nearby. Multiple sclerosis. Multiple sclerosis is a condition that causes inflammation on various parts of your body. You might also experience fatigue, muscle weakness, or numbness in your legs. Additionally, you might experience stiff muscles, headaches, and memory loss. Postural migraines. Postural migraines are caused by problems with the way your body moves. When you have a migraine, you might experience dizziness, vertigo, burning sensations in your mouth, or constipation. You might also experience eye pain, dizziness, or vomiting. Treatment for migraine. You can treat migraine by following several steps. Here are a few things you can try. Avoid stress. Stress can exacerbate migraine symptoms. Try relaxing techniques such as deep breathing exercises or yoga. Get plenty of sleep. Several studies have shown that lack of sleep can exacerbate migraine symptoms. Aim for 7 to 9 hours of sleep each night. Exercise. Physical activity can help reduce tension in the mind and body, which can help alleviate migraine symptoms. Use of topical medication that blocks receptors. Topical medication that contains chemicals called receptors can be helpful in treating migraine. For instance, lidocaine is known for its ability to block receptors in the trigeminal nerve that leads to migraines. Avoid alcohol consumption. Drinking alcohol can exacerbate migraine symptoms. Diagnosis and treatment. If you have migraine, it's important to see a doctor to determine the best treatment plan. A doctor will likely recommend starting treatment within 5 days of the first symptom. Overhead lighting is often recommended as well. However, this should only be used during nighttime and in areas where sunlight isn't available. Once a doctor determines what your treatment needs are, they can prescribe the right medications. If you want to learn more about migraine, we suggest reading our article on the subject. We cover everything from general information on migraine to more detailed details like treatments and side effects. Whether you're looking to understand migraine better or seek expert advice on finding a therapist, we hope you find all the answers you need.